Good morning, everyone. I've read a question recently coming from a graduate, probably 1 year out, um, mentioning that they are facing many patients coming back with sensitive fillings after they finish the fillings. So I thought I will record a quick video just to explain how I dealt with something like that. First, I will leave you with a better view. So for context and credibility, my name is Khaled. I'm a dentist in a private practice for 20 years. I grew my practice from 1 chair to 10 chairs with a team of 40. And probably I hired many new graduates over the years. So this situation, I have a similar situation that I dealt with some graduates in the past as well. And that was my answer to them. Sensitive fillings are usually due to many reasons. The most common ones that I faced myself, probably issues with contamination, issues with bonding, and the most common is issues with occlusion, which always tend to be missed, especially if you don't have a lot of experience. So my advice or my quick tips, number one, before you start your filling, mark the occlusion. So get your marking paper, mark where all the occlusion spots are in centric first, then wipe it down, then eccentric, then in protrusive. Try to take images if you're a beginner and save those images, or take a mental image. Remember exactly where the spots are. So when you finish your filling, you try to mimic something very close to that. It's a very important tip. Second one, a lot of graduates tend to use the high-speed handpiece for like 1 minute, then put it on the bracket table and spray a lot of air to have a look and check. So they drill for 1 minute, stop, spray, check, drill, stop, spray, check. You get what I mean. And that's not fun for the nerve. And it will allow a lot of contamination into the pulp as well, especially if you're not using a rubber dam. So my advice is to use the high-speed handpiece, and use your Fisher Bear to remove all the decay from the walls, all in one go. Don't put your handpiece down until you visually can see you have removed most of the decay on the dentino enamel junction on the walls. Once you finish with that, you can put your high speed down, then use your slow speed Bear, 10,000 RPM with no water. And make sure you have good isolation. You don't want saliva into your dentine, especially freshly cut dentine. So I would use this, again, I wouldn't put it down until the decay has stopped. Then how I know the decay has stopped, the Bear will keep cutting with minimal force, with a scooping action until it's not cutting any more dentine. Now there's a lot of talk about affected or infected dentine, and it's beyond this video. That's what I have been doing myself for over 20 years to simplify things. And that's when I can put the handpiece down, get my mirror and check the margins, check any undermined enamel, and just fine tune the prep. Then putting a matrix band, how you put it is very, very important. Make sure there's no leakage. I use V-rings and different flexible wedges. Most importantly, bonding, I would use a total etch, so 15 seconds on the enamel, then 15 seconds on the dentine, wash, dry, not too dry, then use groomer, dry it gently, then I'll apply 3M single bond. Now the trick here is to apply a coat of single bond. Use the air very gently to thin it. You don't remove the whole bond, you don't have to be too thick. The main aim is to evaporate all the solvent. Once you see the bond is not shaking when you're blowing the air gently, then you know the solvent have evaporated. Then after that, you cure. Then when you place your composite, it's very, very important. The composite on the walls are not touching to respect the C factor. So make sure you put it on the buckles and put it on the lingual, and make sure they're not touching at all, so it shrinks towards the wall. If it's like a class 1 cavity, make sure they are not touching on the floor. So there's a layer towards the mesiobuccal, layer towards the mesiolingual, and the other cusp, and it's shrinking towards those cusps. If it's a class 2, make sure it's in the proximal box, on the buccal wall first, on the lingual wall first, and the floor are not connecting together. Once you finish your filling, most important thing, the occlusion. Check the centric separately, adjust it fully, then check eccentric, then adjust it, Then check protrusive. You have to check the 3. If you miss one of them, you'll have a high contact on a cuspal incline, and the patient will come back complaining of sensitivity. If you check the 3 at the same time, it's madness. It's impossible. You cannot check centric, protrusive, eccentric, and adjust them at the same time. It's crazy. Don't do that. And if you have an image of the previous occlusion marks, try to get very close or mimic them. Lastly, patient expectation. Tell the patient you'll be sensitive for a week or 2. Doing something cold, you're gonna feel it for at least 2 weeks. If it's after 2 weeks, call me. If it's the next few days you cannot bite on the tooth, call me, because I might have to adjust occlusion. There could be a crack there as well that was missed, or hard to visualize. So I need to see you if you have any problems. Never ever tell them or put a feeling and tell them you'll be fine, you won't have any problems at all. Always tell them you'll be sensitive for 2 weeks at least, especially with cold. If you have any pain, any problem, please call me. I need to see you. And of course, if the cavity was close to the nerve or deep, that would be a whole different discussion as well. Lastly, before I end the video, I always get this, like, many of my patients are complaining, many of my patients are doing 1, 2, 3, 4. Always be subjective with your numbers. When you say many, are you seeing 100 patients placing 100 fillings and you're only seeing 5 complaints? Are you placing 100 fillings on 100 patients and getting 80 complaints? Numbers are very important and tells a lot of important information, because our brain tends to focus on 2 out of 100. We might have 2 patients that are complaining out of 100, and because your brain is designed to focus on the negative to protect you from this negative events from happening in the future. You'll tend to dwell on those 2 and think there are many, way too many patients. So having numbers are very important when you have discussion with someone experienced. Thank you so much, and I hope this video is helpful for you. And if you have any questions, please feel free to reach out.